Good evening, and thank you for joining me. I would like to discuss aspects of the Department of Defense Appropriations Bill for fiscal year 2013, also known as the Senate Report 196-112. I will start with the importance of the bill to me and my field, its historical development, and the controversial viewpoints between parties. I will then follow with stakeholders who were and are still part of this legislation, my advocacy from using my part of it, and how I would innovate with it. Not only does this bill bring funding to my organization through different aspects of operations, equipment and maintenance, research, and my paycheck, but value with it what will be my everyday work. It was a point to make that this bill does not cover construction, foreign military assistance, nuclear weapons, or civil defense. I will be focusing on Title VI, the Defense Health Program. The appropriations bill that year puts forth the integrated electronic health record to better link all military treatment facilities around the globe. This electronic health record will also connect those military treatment facilities to the Veteran Affairs medical facilities and replaces any current electronic medical record that each facility is using. Title VI of the Senate Report 196-112 also focuses on research and development for traumatic brain and spinal cord injuries, psychological health, integrative medicine, and private sector care, as well as other healthcare needs. As I previously mentioned before, there were efforts by Congress for the military to collaborate on establishing some sort of electronic health record. This legislative, including the integrative health record, began on March of 2012 with Appropriations Subcommittee on Defense and concluded 3 months later in 2013. The program Executive Office Defense Health Management Systems were chartered by the budget and then passed by the Secretary of Defense. In 2015, the electronic health record contract was awarded to the Leidos Partnership for Defense Health and developing the military health system Genesis. After development and implementation at Fairchild Air Force Base in 2017 at the 92nd Medical Group, it was stated by Air Force Surgeon General Lieutenant General Mark A. Edgar that it was going to be pushed worldwide by year 2022. Now, controversial viewpoints were put to the test with the Budget Control Act as the appropriations bill was exceeding by $7.5 billion. This was an effort to reduce overall debt by nearly $1 trillion, with planned spending by over the span of 10 years. Republican Senator Rick Mulvaney found that the spending of the Budget Care Act ironic because it was supported in previous years. Democratic Senators Lee, Van Hollen, and Smith countered with an amendment that would cut $7.6 billion to level it, and Lee stating, "A deal is a deal." It was also noted that no reductions from that would come from service members or their health care. Democratic Senator Van Hollen also brought up that it was an offense to bipartisan agreement because spending increased after the House Appropriations Committee had agreed on their caps. Republican Frayling Hewson opposed the Democratic viewpoints because reductions in the Department of Defense appropriations had already been reduced significantly. As I mentioned before, senators, subcommittees, voting members, electronic health record developers were of course stakeholders when deciding upon the appropriations bill and developing the military health system Genesis. Their decisions of the legislation, Title VI specifically, will also be given as orders to the military medical operations agencies across all branches of service, the military treatment facilities that they oversee, and the men and women that work within them. Seen here is only 63 military treatment facilities in the Air Force in the United States that is effective, and this is not to mention the number of naval bases, Army posts, and Veteran Affairs medical facilities who will also be seeing the Military Health System Genesis electronic health record going into effect. Each of these MTFs and Veteran Affairs medical facilities care for tens of thousands of beneficiaries, including service members, veterans, and their dependents. Finally, taxpayers will and are still playing a role because all of this is funded in part by the federal tax dollar in development for and implementation. Now, as a consumer, I am advocating for Military Health Service Genesis and Title VI of Senate Report 196-112 because of the ease of registration it will be giving. Once fully implemented, no more will we have to register with each MTF if we're deployed overseas, temporarily deployed yonder in other states, traveling on leave, or having been seen in a case of an emergency somewhere in between them. Military Health Service Genesis is also running multiple health services, such as ancillaries, on the same system. This will keep the records in one place and make it easier for continuation of care. As a user, I'm advocating for this bill because it is expecting that integration of systems into one source. This could be our medical care and our billing, which would, of course, make my job easier. Because there is so much going on in the Military Health Service Genesis integrative electronic health record, I find it suiting to innovate it further with artificial intelligence. Artificial intelligence has multiple areas where it could be effective when using electronic health records, according to Davenport, Hansermeyer, and McCord last year. For example, artificial intelligence would increase productivity through extracting data and highlighting terms and insights. By predicting treatment protocols with diagnostic algorithms and process provider notes with clinical documentation. Finally, artificial intelligence could also help with strategizing in support of treatments of patients, and having complete picture of an electronic health record seems like an opportunity to allow medical providers and staff the assistance of artificial intelligence in the quality of treatment that they give their patients. If I was to implement any type of innovation, it would be amending Senate Report 196-112 with the introduction of artificial intelligence in the electronic health record. In summary, I introduced you with the importance of Department of Defense appropriations bill for fiscal year 2013, specifically Title VI, the Defense Health Program, and how I'm influenced by it and the integrated electronic health record that it presents. I took you through time where the electronic health record was being collaborated in 2008 to the successful implementation in 2017 at Fairchild Air Force Base. I spoke with the Republicans wanting to increase spending and the Democrats who wanted to cap it at the originally agreed price. I conveyed the stakeholders who were and are still involved, from the senators, the developers, beneficiaries, to the taxpayers. I expressed my advocacy for the bill as a user and a consumer, and finally, I sounded off with how I would innovate the bill and the electronic health record with artificial intelligence. This concludes my presentation of the Department of Defense Appropriations Bill for fiscal year 13. I would like to thank you for your time today and listening to me discuss multitudes of the Senate Report 196-112.